So we use the stepped care evidence-based approach to match the individual needs to the level of care required. And as you can see from that slide, it comprises of a hierarchy of different interventions from the least to the most intensive. And that's always on the back of an outcome of a triage. So it's about ensuring that our members can access the most appropriate service for their health needs at any given time. So in relation to today's topic surrounding stress awareness and mental health, what that looks like and what you can see from the slide is it starts at step one with facilitated self-care. And that's all around connecting members to our self-help tools. It could be community services, our extensive helpful library of articles and other educational resources and advice. Then it goes up to step two, and that's counsellors and peer support work. Again, our cases are always triaged through one of our nurses, and the member will be assigned level 2 mental health pathway. That therapy is provided through registered, trained and credentialed counsellors, like what Dr. Julian's team support. And then you've got that level 3, which is similar to level 2, but the therapy is conducted by a clinical psychologist, not a counsellor. And then you've got step 4, which is more specialist, complex treatment. Again, the case is triaged through our nurse team. Members in this category generally have existing mental health support through community care. So they're often known to these services because they have extended history of mental health. And where necessary, the Sonder site team will support and transition these members to the correct service based on the complexity of the needs of the case. And then you've got that last sort of step 5, acute intervention, again, triage through a nurse. But that may include engagement through one of our professionals here with emergency services, emergency departments, could involve ambulance services, if required in some circumstances. And, we can also deploy one of our Sonder responders to support with these as well as we have on-call doctors there to support us with any sort of support and advice that we need in relation to that pathway as well. So I guess to kind of explain a little bit more about our stepped care model, a member can reach out and be supported through any of those levels. They don't have to start at step 1. They can go in at step 3 if that's what required, or even up to step 5. But to give you an example, it could be that the member's case comes through and they could be struggling with sleep. They've not tried any self-help solutions yet. It could be their first time using the app. And we might, in that instance, provide them with some helpful sleep podcasts. It might involve doing some journaling so they can get a good night's sleep, and providing some really good educational content and advice surrounding improving their sleep. So that would be, I guess, our step 1, which would be, providing education. Equally, that member could come in at step 3 or could have tried step 1 first. And the other end of that scale, they could be still experiencing really bad sleep. It's been going on for a matter of months. They've tried all sorts of things, herbal remedies, podcasts, still struggling, and actually have several other factors, which Julian spoke about earlier, that are affecting their life. So that could be diet and anxiety, low mood. In that case, we would triage the case by one of our nurses and then arrange an appointment with Dr. Julian and get them on the right track. So that would be either step 3 or step 2. So like I said, a member can reach out and they can be helped and supported through any of those steps. But I guess what we understand here at Sonder is everybody's journey is very different. So we like to tailor those responses in terms of what the member really requires.